Built into our brain and the autonomic nervous system is the ability to respond quickly to a dangerous situation. We are all familiar with this fight or flight mechanism and how it makes us suddenly more alert and prepares our body to confront a danger or flee from it. But when this fight or flight mechanism creates these changes in our body on a daily basis, in the absence of any real danger, the anxiety created can make it difficult or impossible to cope with everyday life. Many people suffer from this abnormality of the fight or flight response, and the resulting anxiety can take many forms. First, we will discuss the different types of anxiety and their signs and symptoms. The first type we will discuss is generalized anxiety disorder, or GAD. When excessive worry interferes with daily living on a regular basis, the patient can be said to have generalized anxiety disorder. Clinically, a person is considered to be suffering from GAD if anxiety interrupts her daily functioning during a majority of days over at least a 6-month period. The symptoms generally appear in clusters, and no two people present in exactly the same way. Symptoms may include excessive worry, restlessness, being easily fatigued, having difficulty concentrating, irritability, muscle tension, and sleep disturbances. Generalized anxiety usually revolves around a number of events or activities, like work or school, and the home and the job. The person is not able to cope with the daily life of these activities, or is just barely coping because of the anxiety. The essential feature of another form of anxiety known as panic disorder is recurrent panic attacks. A panic attack is marked by the sudden onset of intense fear. There is rarely any discernible cause for the panic, but the body's fight or flight mechanisms abruptly create all the sensations of great danger.
So built into our brain is the ability to respond to fear. And the fight or flight mechanism includes a fast heart rate and a change in our breathing so that we will be ready with enough oxygen to run away. What happens with anxiety is that this is an abnormality of that mechanism. And so a person who has a tendency toward this illness has the experience that something changes their breathing or their heart rate, and it trips the entire experience of terrible anxiety, a fast heart rate, and changes in the breathing pattern. Since this is a necessary mechanism, we can never suppress it forever, and this is what makes panic attacks so interesting. We can suppress panic attacks with medication, and people can get rid of them sometimes with behavioral therapies, but in fact, the experience of anxiety about something frightening always remains.
Common symptoms of a panic attack include a sudden onset of heart palpitations, perspiration, trembling, sensations of shortness of breath, nausea, and dizziness. Left untreated, panic attacks can lead to the next type of anxiety, phobic disorders. A phobia is an irrational fear resulting in a conscious avoidance of the feared object, activity, or situation. To constitute a phobia, the fear has to be persistent and unreasonable. Some common phobias include abnormal fears of going outside, into public places, or agoraphobia, and fears directed at many other things or situations. Fear of strangers, animals, insects, germs, or any new situation. Whatever the item or situation that causes the fear, the phobic entity, anticipation of meeting it will elicit severe distress and anxiety. Often the sufferer from a phobia recognizes that the fear is excessive but cannot help it. Phobic disorders can be very disruptive of daily activities and cause the person to retreat and hide in a place of safety. Phobias can sometimes lead to withdrawal or aggressive behavior or thoughts of suicide. Left untreated, phobias can give rise to other psychiatric conditions, such as general anxiety disorder, major depression, and alcohol or substance abuse. One further form of anxiety is obsessive-compulsive disorder, or OCD. Individuals with OCD feel compelled to perform certain ritual acts, such as hand-washing, over and over to relieve their anxiety. They are often preoccupied with rules, regulations, orderliness, neatness, details, and the achievement of perfection.
Anxiety disorders such as obsessive-compulsive disorder are listed that way because if you try to interfere with the rituals that the patient must perform, they become extremely anxious. Without any interference, the illness doesn't show anxiety. What it shows is this repetitive requirements for certain thoughts or certain actions, and of course is tremendously disabling.
There is some evidence that this problem is a neurologic dysfunction. Recent studies indicate that there is a problem with the switching on and off mechanisms in certain areas of the brain, and this leads to OCD. Whichever form of anxiety disorder a patient has, the condition can be disabling and prevent him or her from performing daily activities.